Politics and the pandemic, plus Latin America passes Europe as the region with the most COVID deaths in the world. Hello, I'm Mike Walter, sitting in for Anand Naidu, and this is The Heat. The United States reported more than 44,000 new coronavirus cases on Tuesday, up about 9,000 from the previous day, according to data from Johns Hopkins University. The U.S. leads the world with the most cases and deaths, followed by Brazil. We'll have more on Brazil and Latin America a little bit later on in this program. But first, here in the United States, it's political season with the pandemic at the top of the agenda, and debate over everything from reopening schools to potential vaccines. So let's get straight to our panel. Rishi Desai joins us from Oakland. He's a pediatric infectious disease physician and the chief medical officer at the health education platform osmosis.org. Peter Chin Hong is a professor of medicine and infectious disease specialist at the University of California in San Francisco. And with us from the White House is our very own colleague, Nathan King. Nathan, we threw out some numbers there. Let me throw another one at you. 75, that's about how many more days we have until we have an election here in the United States. And I'm reminded of 1980 when Ronald Reagan used to famously say, "Are you better off today than you were 4 years ago?" And of course, at that time, he was talking about the economy, and it seems like the economy always trumps everything else. But this year, it seems like the health of the people is even more important than the health of the economy. How important is this going to be as an issue in this race?
You know, I'm reminded of also the Bill Clinton campaign. It's the economy, stupid, and it is the economy, stupid, but it also is COVID, stupid. And the two are most intimately entwined because it's also lives and livelihoods. You see this play out here at the White House, haven't you? You know, obviously they were surprised and caught unaware, and there were mistakes made, and they thought, well, the US president thought it would just go away, et cetera, and then it was isolated to states, and then it spread, and then it got worse, and then it got worse, and you try to reopen. So all this is the backdrop. What we can see is the polling in the American people are essentially saying, we really are worried about COVID, we are worried about schools reopening, we are worried about the president's handling of the coronavirus, and this, of course, is a very, very important campaign issue. However, this president doesn't want to campaign on COVID. I totally understand that, considering where the numbers are. We just had his daily coronavirus briefing, although stop calling it that. It's just now his daily briefing. And again, he said, look, it's going away. He compared it to the flu again. He even brought up spikes in cases elsewhere, including New Zealand. What did New Zealand have in the last 24 hours? Was it 6 new cases? No deaths? What do we have in the last 24 hours here? Well, 1,350 deaths. So that's the sort of messaging that's coming from the White House. The problem is, of course, is that the public are going to have to vote essentially in the fall, and we do expect, of course, it to come back in the fall, perhaps even stronger. Look at other global pandemics, for example, in 1918 with the flu season, it came back stronger. So, you know, in the president's words, we'll have to wait and see. But the backdrop politically is not good for the U.S. president.
And Rishi, let's talk about another hot potato, which is the opening of schools. And of course, we can start by just talking about universities. We're seeing a lot of problems there. It's not even a red state, blue state divide here. I mean, you're looking at North Carolina, Chapel Hill, and then you look at Washington State, you look at Ole Miss in Oxford, Mississippi, and then not far from you, Berkeley. A lot of young people driving this, and it's also a concern to the World Health Organization. Let's listen.
The epidemic is changing. People in their 20s, 30s, and 40s are increasingly driving its spread. Many are unaware they're infected with very mild symptoms or none at all. This can result in them unknowingly passing on the virus to others. This increases the risk of spillovers to the most vulnerable, the elderly, the sick, people in long-term care, people who live in densely populated urban areas and underserved rural areas.
So, Rishi, when you think of people in their 20s, you obviously think of universities, college students, but it's not just there. I mean, we're seeing this in high schools in Georgia, Mississippi, Indiana, where these cases are just popping up. What are we learning from these early days of school opening up here in the United States?
You know, when you paint that picture, if you ask someone about a high school student or college student, what images pop up in your head? You think about kids that are going to parties. You think about kids that are going to sporting events. These are the images you have, and certainly probably most people that are beyond those years reflect on those as some of the most memorable times they had. And so, whenever you're thinking about that group of highly social creatures, which are kind of kids in their 20s, that is a problem when you're talking about, a solution of social distancing. So it is really problematic that we're seeing these universities open up. And the fact is, I think there's a real debate and really merits to both sides of the arguments of, why we need schools to open and why we also need to kind of be socially distant and cautious. I think the real value is in the younger kids less than 10, where we know that they're less likely to be transmitting it. They're less likely to be congregating in the hundreds, if not thousands. And really, the value of school among those groups is quite high. And so I think that that's where we should probably put our focus. If talking about schools reopening, it should be for the younger kids, not so for the high school and college years.
Peter, it's interesting. I lifted this quote from Education Week. It was from a professor of epidemiology at the University of North Carolina, Whitney Robinson. He said, "I'm shocked that anyone would be shocked to find COVID cases in schools. The only thing that would be shocking is if they didn't have a plan for it." Does it seem like the schools are prepared for this?
I think, Mike, the schools are prepared for the initial phase, which is, the testing of folks when they come in, but they're not prepared for the aftermath, which is, how do you supervise students off campus? How do you keep people from, as Rishi said, being the social animals that they want to be? How do you continue to test folks once they get to schools, and what periodicity? So I think all these questions remain to be asked, but whatever they are, it seems that our national experiments with return to colleges is kind of failing right now.
Nathan, I have to ask you about the effect this has on the educators, because they're not kids. I mean, a lot of these people are older. They're going into the classroom. They can obviously get this. A lot of them at risk. We're already seeing New York State school teachers threatening to go out on strike if schools reopen. I mean, there's going to be a backlash, in a sense, I would think, from educators. That can be a concern as well.
Good. I'm relieved. I thought you were going to ask me about my college days.
We'll ask that later.
But we weren't social distancing. What I was going to say, yeah, absolutely right. In fact, one big teachers' union has already said that they reserve the right to essentially tell their members that they can put out on strike. I was listening to a fantastic report earlier today on New York Public Radio, where essentially one chancellor was literally walking around the areas in which students lived, these fraternity houses and the like, telling them, please don't hold these parties, encourage them to get in touch and respond to contract tracers. They made sure they had enough dorm space so people could quarantine. They even went around with local council members. This is a real problem. Now, the problem here is the messaging from the White House. As I said, the US president just held a briefing, and he basically stressed that if you're under 44 years old, that you really don't get this virus as much and you don't suffer the consequences, and it's mainly people who have underlying health conditions and then older people as well. Now, that's true. Scientifically, that is true, but it's not a great message to send kids like me when I was 21 or whatever, and as they're going back to college and hadn't seen anyone from them.
And I don't want to interrupt you, but I saw Rishi rolling his eyes and shaking his head, so I've got to let you jump in.
Well, I think the messaging is, just as you said, the messaging is inaccurate and it's incomplete, right? Like, a lot of the messaging is around mortality data, which is, are you going to die from COVID-19? And the facts bear out very clearly that mortality data is, of course, going to be lower if your age is lower. That doesn't speak to two important things, which is chronic illness as a result of COVID-19. A lot of folks, weeks out, months out even, can continue to have residual effects from having COVID-19. We're seeing strokes in younger individuals. Young kids can get MIS-C, which is an inflammatory condition like Kawasaki. So that all is true. But secondly, that you're an important part of the solution if you're under 44, and that has to be a factor in how you make decisions. And that, if you're carrying this and driving this to your parents, your grandparents, most people under age 44 have parents and grandparents in their lives. And so if those are people you care about, then you got to do your part.
And Peter, let me ask you about vaccines, because we know it's not going to be a silver bullet, but Russia out saying that they have one, and any of these concerns about safety, they're groundless. But let's listen to Dr. Anthony Fauci and his take on it.
Having a vaccine, Deborah, and proving that a vaccine is safe and effective are two different things. We have half a dozen or more vaccines. So if we wanted to take the chance of hurting a lot of people or giving them something that doesn't work, we could start doing this, next week if we wanted to. But that's not the way it works. So I hope, but I haven't heard any evidence to make me feel that's the case. I hope that the Russians have actually definitively proven that the vaccine is safe and effective. I seriously doubt that they've done that.
Peter, how will Russia stand up to international scrutiny of their vaccine?
I think very poorly, Mike. I think it violates my 3 tenets when I think about talking about vaccines. You think about testing, so has the vaccine gone through a logical transition from phase 1, from the lab to phase 1, 2, and 3, meaning that you test the vaccine in a small group of individuals, really looking at safety more than efficacy, and you increase the numbers. Russia hasn't really shown us that in evidence. The second is transparency. There's been no peer-reviewed publication from Russia about that Sputnik vaccine, as they call it. So I guess they violate that second one. And the third is trust. We don't have a lot of evidence about safety, again, from the vaccine candidate from Russia.
Let me ask you about the vaccine race in the West. Of course, we've got a number of them that are being discussed. Also in China, I see that I think the first patent was issued earlier this week. How significant is that? How's the race right now?
I think the race is really led right now, in my opinion, by Oxford and the AstraZeneca combination. They're the furthest ahead. They're already in phase 3 studies. It's been peer-reviewed. Everyone's pretty excited about it, and they're also part of Operation Warp Speed in the U.S. But there are a few other good ones as well. Moderna, the disadvantage of Moderna is that no one has really used an RNA vaccine before. And of course, there are the Chinese vaccines. The CanSino vaccine has been published in phase 2 in the Lancet, so that's pretty exciting. And then one that hasn't really been as studied yet is the Sinovac vaccine from China. The reason why it's exciting is that it's inactivated, so that it's the first inactivated vaccine of all the groups. So I think there are a bunch of candidates. I'm very optimistic about some of them.
And if the U.S. does succeed in that vaccine approach, Nathan, that will be good news for the United States, because right now there's this new poll out from CNN. 7 in 10 Americans are embarrassed by the U.S. coronavirus response. Got about 30 seconds. What's the take there at the White House?
I've got another poll for you, though. 55% of Americans say they won't take a vaccine. And that is going to be a real problem because the anti-vaxxer movement is quite big. And actually, they have a lot of people within the administration who are at least on the fringes of it. So it would be great news if the US got a vaccine, if China got a vaccine, if Russia got a vaccine. It'd be great. What really missing here is this global good idea. I mean, the US has pulled out the WHO. No one is really cooperating because the barriers are being put up. Let's have a global vaccine, whoever makes it, for free for everyone. It's pretty easy.
All right.
If it happens. Sorry, it's so important.
Yeah, we're going to have to leave it there. Thank you so much to our panelists. We need to take a break. When we come back, why is Latin America now the worst region for COVID deaths in the world? Stay with us. You're watching The Heat.
To know about China. China 24, only on CGTN.
Welcome back. While the United States leads the world with the most deaths from COVID-19, Brazil and Mexico rank second and third. And as the pandemic accelerates in Colombia, Peru, Argentina, and Bolivia, Latin America has now passed Europe as the region with the most fatalities. Joining us to talk about all of this is journalist Gustavo Ribeiro. He covers Brazil and Europe as the founder of the Brazilian Report. And with us from Boston is Marcia Castro. She heads the Department of Global Health and Population at Harvard University's Chan School of Public Health. Marcia, why don't I begin with you? Talk to us broadly about what's happening here. I mean, we're looking at more than 6 million cases right now. That's around a third of the global total. Why is Latin America getting hit so hard?
Yeah, so I think this is a story of both leadership and how leadership failed a region that has a huge inequality across the population. So if you take Brazil, we have a leader that basically denied the importance of the virus and failed to use the network of services that we have, a universal healthcare system and one of the largest community-based primary care programs, which was the one shot Brazil had to show to the world how to respond to a pandemic, using those services, using a network of almost 270,000 community health agents that could have made a difference by working in communities, targeting vulnerable people, people that are more exposed to the virus, that have no water at home, that cannot stop working, cannot work remotely, and could be quickly identified, quarantined if necessary, and those agents could develop also contact tracing. We have very small testing still to this day, and it made it very hard for local governments, mayors and governors to deploy control interventions, facing the challenge of having the president on TV saying that, you know, it's not important to use masks, you shouldn't do so physical distancing, and basically promoting a treatment that has absolutely no scientific proof. So it's a failed leadership combined with a denial of science that basically puts Brazil in the position that we are now.
So Gustavo, just to kind of riff off what Marcia just said, how much is that, leadership or lack of leadership contributing to the problem in Brazil, do you think?
I think it's paramount for the Brazilian situation because, like she said, Brazilian President Jair Bolsonaro from the get-go became one of the biggest COVID-19 denialists in the world. But I would add, besides leadership, I would add one other aspect that I think helps explain why the situation has derailed so much in Latin America, and that is inequality. Because we have places in Brazil and in other countries in the region where social isolation is not an option, where people lived in poor housing conditions in very packed, densely populated areas. And that makes all the more important for leadership to step up and to do whatever it takes to reduce the risks of transmission. But even in countries that took the pandemic seriously, like Argentina and Peru, things have derailed in big part because of the fact that for many people, access to healthcare and the possibility of social isolation is not the same.
We're talking about leadership, we're talking about Jair Bolsonaro, but there's an opinion piece in Bloomberg which cites a number of Latin American leaders, not just Bolsonaro. They talk about Mexico's Andres Manuel López Obrador. If you combine those two countries, they say that it's a fifth of the reported global fatalities between them. And then you look at Daniel Ortega in Nicaragua. He says COVID-19 is under control, and yet epidemiologists in the country say that's simply not the case. Maduro is actually calling people who come in contact with COVID-19 bioterrorists. So leadership, getting back to that question, and the ripple effect. Marcia, why don't I just talk to you about this first, and then I'd like to get Gustavo to jump in as well. But we're not just talking about one particular leader. Bolsonaro is such a huge figure. He's kind of this larger-than-life character. But this is a problem that's systemic, isn't it?
Yes, it is. And I'll give you two examples. So if we take Mexico that you mentioned, The president also denied the importance of the virus from the beginning. And he's been very vocal, basically saying that he uses religious amulets and clear conscience as a protection against the virus. And he's telling the population not to go to hospitals, which is insane. I mean, a lot of people in Mexico are dying at home even before they search healthcare. And there is a study that was done recently showing that 70% of the population in Mexico don't trust going to the hospital or taking a family member to a hospital. So the excess mortality in the country is way above the number of COVID deaths. On the other extreme, we have Uruguay, a country that also has universal health access, that right from the beginning was extremely quick in adopting measures of physical distancing. All the non-pharmaceutical measures were quickly adopted. In 2 months, they increased the number of ICU beds from 19 per 100,000 people in the country to almost 30 per 100,000 people in the country in only 2 months. So Uruguay never had that peak that everybody's always anxious to know when we're going to pass the peak. They never had it because they used the health systems. They were very fast in responding, and they increased the supply of resources that they knew were needed. That's good leadership.
And Gustavo, I want to give you a chance to also talk about the leadership vacuum. How big a problem is that?
It's extremely problematic, and we see throughout the region a lot of leaders, like you mentioned, that disregard scientific evidence and that have overly politicized the issue of COVID-19. However, I would like to just add a little caveat that it is complicated to compare a country like Uruguay to countries like Brazil or Mexico in the way that it is a very small population of around 3 million people. It is a much more homogeneous population, and it is a much wealthier country than in other areas. With that being said, I think that, for instance, in Brazil, few people have done more than Jair Bolsonaro to make things go so bad so quickly. And the president, not even testing positive himself, and not even with the fact that the presidential palace has become a COVID-19 hotbed, not even that has changed his stance. And to this day, he continues to not wear a mask sometimes when creating public gatherings on the streets, and has time and time again defended unproven methods for treating the coronavirus.
Marcia, it's interesting. In preparation, I watched a panel discussion you were on last year where you were talking about the Zika virus, and you addressed the outbreak in 2016. You talked about the fire brigade public health approach. You said Brazil got rid of the fire, but you asked the question, are they ready for the next fire? Apparently they are not. But one of the things you talked about was investing in infrastructure, being prepared for the next time. You said there would be a next time. So did Brazil drop the ball? I mean, they had the opportunity to really kind of build off of what happened in 2016, and they did not.
So unfortunately, I guess the answer is yes. When the pandemic started in Brazil, it basically arrived in a moment when the health system is subfinanced. Since we had the austerity measures implemented, so basically a decision to cut the investment, not just in health, but also in education and social services. So we basically entered the pandemic with about 23 million reais that are not invested in health. We also missed an opportunity to become independent in the production of medicines and the production of, for example, protective equipment. So basically equipment that hospitals need, public hospitals, especially because of the public system. And we basically let this opportunity go at the end of the 90s, and we depend on other people. And I think never before we realize how important globalization is at a moment when every single country needs the same kind of good and you cannot get. So I think Brazil basically did not invest as it should in the health system. Unfortunately, our health system is very valued and even envied from other countries, but it's not really given the proper value inside the country. And when Zika came, Brazil gave the right response. First, it trusted the scientists. It provided resources for the scientists in the country to provide the knowledge that was needed to be able to respond. That's the very first huge difference. If you see what's happening now, science not only is ignored, but we have protocols issued by the Ministry of Health basically telling people how to take a regimen of chloroquine and hydroxychloroquine, although there is no evidence. That's a huge contrast just right there. So I think we missed a huge opportunity to do much better.
Gustavo, let me talk to you about borders, because a few years back I was in Guyana. It didn't take much to go from Lethem into Boa Vista. You cross the border, there's maybe a couple of guys there. All these borders are so porous, and we know that the virus doesn't know borders. How easily transmitted is it, and how much of a concern is that?
It's a big concern. We at the Brazilian Report have talked to Paraguayan authorities recently, and there is a big scare in there that, for instance, football is resuming in Brazil, and we're going to have very soon the Copa Libertadores, the Intercontinental Cup, and everyone is scared to have Brazilian players there. But like you said, it's very hard to control the borders here. We have forest areas in the Amazon. We have the Brazilian-Paraguayan border. It's very hard to control. And that's why most countries have closed their borders to Brazil from the get-go. Uruguay still has enforced very tough controls in their borders against with Brazil.
And Marcia, the Pan American Health Organization, it's a regional arm of the World Health Organization, is out with a warning. They say that there's going to be an increase in other diseases because of the high demand on health service and suspension of routine vaccinations due to the pandemic. I was talking to a doctor today, and they were saying, look, you might think about middle of September, late September, go get your flu shot, because, boy, it's going to be really bad with the double whammy. Talk to me about the fact that, you know, we're looking at influenza coming just around the corner. How bad is this going to be within the region?
Yeah, so we have competing risks here. In fact, Brazil anticipated a little bit of the vaccination campaign for the flu, so a lot of people have been vaccinated. But we are in the middle of an epidemic here for dengue, and we have type 2 circulating. So this was already going on even before the first COVID case. It's not just vaccinations, but the entire primary care program has been compromised. So people that used to be followed up for high blood pressure, cardiovascular conditions, those people are not being followed up as before. So we are facing a situation that we could have an increase both of infectious diseases, some preventable by vaccines because they are not being given, but also chronic conditions due to the lack of primary care. And there's still a third one. I mean, I'm sure you know about all the fires that now are not just in the Amazon, but also in the Pantanal and in the drylands. And we always observe an increase in respiratory conditions and hospitalizations following the fires. This is already happening in several cities in Brazil. And usually we also see an increase in mortality of children under the age of 10 because of the respiratory conditions. So it's layers and layers of different burdens of disease that we can observe until, you know, for the months to come.
Layers and layers. We're going to have to end it there. I want to thank Gustavo and Marcia. Thank you so much. And that is it for this edition of The Heat. I'm Mike Walter, Washington, D.C. Thanks so much for watching.